We're sitting down this morning with Austin CyberKnife to discuss prostate cancer symptoms and treatments. Dr. Paiman Ghafouri is a board-certified radiation oncologist with Austin CyberKnife, and he's here with more. Good morning, doctor.
Good morning.
Thank you so much for being here. Let's talk a little bit about latest studies in prostate cancer treatment. What's coming out?
Sure. Prostate cancer is a very common cancer. Next to skin cancer is the most common cancer in men. So there is a lot of ongoing studies to try to evaluate the best possible treatment options. And one of the more important studies that have been published this year is a new study from UCLA, which shows the long-term safety and effectiveness for treating prostate cancer with radiosurgery, which is the type of treatment that we do with CyberKnife.
Oh, okay. All right. And what were the findings of that?
The findings were that for patients who had low and intermediate risk prostate cancer, men were treated with prostate radiosurgery, and it was shown to have favorable outcomes with a median follow-up of 7 years or longer, both in terms of control of cancer, equal to or better than any other treatment modality that exists, and long-term side effects, things like incontinence, very low risk for that.
Oh, well, that's really good to hear,
Yeah.
especially as someone who practices with it. So let's talk a little bit about how you actually use CyberKnife to treat prostate cancer.
So CyberKnife is a radiation device. It's a robotic radiation device which uses hundreds of little tiny radiation beams to deliver therapy to the prostate gland with extreme focus and accuracy. And the goal of the treatment is to minimize the dose to the surrounding normal tissues, which is what gives the high level of safety and effectiveness.
And I know that I've heard before that there are some really surprising, I think, in some ways, benefits to using Austin CyberKnife, but especially with the amount of time that patients spend, getting their treatments versus living their lives. Let's talk a little bit about the benefits of using CyberKnife.
Right. That's one of the major factors. In a traditional course of radiation therapy with protons or with photons IMRT, it's typically about 40 to 45 treatments.
Wow, that's a lot.
That's a lot. It's about 9 weeks of treatment, daily treatments. And with CyberKnife, it's usually 5 treatments.
Wow.
So
that's a huge difference.
It's a tremendous difference, yeah.
And in addition to the treatment, how quick is the recovery process?
Usually for most patients, actually, there's no downtime or recovery. It's an outpatient treatment, and it doesn't require any anesthesia or any incisions. It's totally non-invasive and painless. The treatment is done in an outpatient clinic, and you're done in about a week.
Wow. I mean,
Yeah.
You can tell modern medicine. That's what I hear when I'm talking to you. Okay, let's talk a little bit about how, in total, this does compare to traditional therapies. When people are looking at the two, for example, what are some of the big things that you see that stand out?
Well, some of the more common therapies for prostate cancer are surgery or traditional form of radiation, as we said, is about 9 weeks. Some things like HIFU or cryotherapy are used. The most important aspect of CyberKnife treatment is that it's totally non-invasive. And so because it doesn't disrupt the anatomy, there is a much lower risk for some of those longer-term side effects. And so we now have the benefit of having much longer-term follow-up in terms of clinical evidence and data that are coming out for demonstrating the safety and effectiveness of these kinds of treatments.
What a positive study to hear about. Dr.
Yeah.
Ghafouri, thank you so much.
Thank
Important
you.
information to hear about this morning. We appreciate it.
Thank you.
Austin CyberKnife is located on I-35 near the Del Seton Medical Center at the University of Texas. Call them 512-324-8060 or go to austincyberknife.com.